Hey everybody, it's Dr. Davis. Today I want to teach you a little something about the ACL. If you watch sports of any kind, you have heard of different athletes tearing their ACL and having to have surgery and the recovery and all that sort of thing. But a lot of people don't really know what we're talking about when we start talking about the ACL. So that's what we're going to talk about today. Here's a model of the knee that I've shown before. The thigh bone is up here. The shin is here, the kneecap is in the front. Now I'm going to take this kneecap off just so you can see a little bit better what we're talking about. There are several ligaments that help stabilize the knee. There's one that runs up and down vertically on the inner part of the knee. That's called the MCL. There's one that runs vertically on the outer part of the knee. That's called the LCL. This is medial collateral ligament. This is lateral collateral ligament. And then there are two that run right through the center of the knee that kind of crisscross at diagonal angles. And that is the ACL and the PCL. That stands for anterior cruciate ligament and posterior cruciate ligament because they cross each other. That's where the name cruciate ligament comes from. The function of the ACL is to help keep the shin bone from sliding too far forward underneath the thigh bone. So if you step and your lower body weight wants to kind of thrust forward, the ACL kind of keeps these two close enough together that they do what they're supposed to. When the ACL is torn, like in this model, it allows the thigh bone and the shin bone to go too far apart. And so it's not tethered anymore. And that'll cause the knee to kind of buckle or give way. So there are two major problems that we see with a torn ACL. The first is that a lot of people with a torn ACL, their knee feels unstable, like they can't trust it. They go to put weight on it and they try to push off and their knee just buckles and gives way. And that's the situation where we generally recommend surgery, because if you can't trust your knee, if it's not stable and secure, then that can really cause a lot of problems. So those are the type of patients that generally have to have surgery. The second problem that we see is, particularly in younger patients, if the knee is allowed to move more than it should, that can lead to a torn meniscus. Now, the meniscus is a separate structure. That's this little disc of cartilage here and here. But if the bones are sliding back and forth instead of just swinging like a hinge, then over time that can lead to damage to the meniscus, and then that's a new problem that requires treatment. So in younger patients, generally we will recommend fixing the ACL simply because we don't want them to develop a torn meniscus later, and so it's kind of a preventative strategy. So those are really the two reasons that we recommend surgery. There are a lot of people my age and older that might have a torn ACL and they don't need surgery because they're not doing activities where their knee buckles or gives way. So not every ACL needs surgery. But if you feel like your knee's unstable, if you feel like you can't trust it, or if you're younger than probably 30 and still do active things, then it probably is worth getting the ACL surgery done so that you can do what you want, you can stay active, and you don't run the risk of causing further harm down the road. So I hope that was helpful. If you have any questions about ACLs, if you think you may be dealing with one and you need help figuring out what the best strategy is, I'd be happy to help. Give us a call at Davis Orthopedics.